Good evening, everyone. I'm Dr. Vivian Asamoah, and welcome to another Facebook Live of Gut Over It. Tonight is Thursday's night, and we are going to be talking about the top myths about colonoscopy. So we are going straight to the point on this one. And I asked my team to provide me with some questions that patients always ask about colonoscopy. So this is one for patients tonight. We are running down that list. Thank you guys for joining me. If you know anyone who has not yet had their colonoscopy and is dreading to have their colonoscopy screening, please share this video with them. We're going to talk about some very simple things to know about colonoscopy and myths that we are definitely trying to dispel. Again, I'm Dr. Vivian Asamoah. I'm a gastroenterologist in Katy, Texas. I am also a functional medicine provider in the month of February, and the countdown is on. We have been doing these Facebook Lives every night at 9 p.m. talking about an interesting GI topic. We have gone through a lot, guys. We have talked through a lot of things. And then I realized I haven't talked about colonoscopy. So this is going to be a great topic. And this week is my last week before I segue into our Natural Gut Relief Facebook group. It's a private Facebook group coming up soon. I'm doing all the work behind the scenes, trying to get some good interviews, some good interviewers, some great mentors that I've worked with to come and talk about their specialty in functional gastroenterology. And I'm very excited to share that with you guys. I hope you guys will all join me on the private Facebook group when we open it up to go live. I'm also honoring, because this is my last week and the month of February is ending, I am honoring Black History Month. And every night my son picks out a very prominent, well-respected mover and shaker in the world of science. And I picked a gastroenterologist. And so I want to, before I even start on anything, I want to talk about Dr. Leonardis Berry, who was born in 1902 in North Carolina. And he got his gastroenterology fellowship at Cook County Hospital in Chicago. So one of the pioneers, one of the Black pioneers in gastroenterology, one of our wonderful Black pioneers in gastroenterology, he worked at Cook County for many years and he became the first Black person to present a paper at the American Medical Association annual convention. The first Black person to present a paper, and that he was a gastroenterologist. So I'm extremely proud. That is absolutely amazing. And he was describing the findings of his examination of the lumen of the stomach using a gastroscope, which is just an EGD that we do in 6 minutes now. So that's amazing. Guys, his name is Dr. Leonardis Berry, one of the first Black gastroenterologists in the United States. He passed away in 1995. So he was 93 when he passed away. Tonight, we're going to be talking about that colonoscopy. So I have my list of questions and we are going to go through these questions. And if you guys have questions that you want to ask, that you want to share, please go ahead as usual. Leave a like, share some love, put your comment in. And I will be working on getting everyone's reply over to them. I know I've got some requests for food handouts, for diet plans, for supplements for liver. So I will be sending all of those, guys, but my priority is to the patients I'm seeing in clinic first. So I will work on this over the weekend. Let's go to our questions. All right, guys. So nice to see you all online. Thank you guys for joining me. We got 2 more nights. I'm going to miss you. I'm not sure what I'm going to do, but I hope you guys all join me on the Natural Gut Relief Facebook group. So number 1, first question, colonoscopy hurts. It's painful. It is not. You are sedated during the procedure. You can choose not to have anesthesia. In my 12 to 15 years of gastroenterology practice, I have performed at least 10, if not 15 procedures on patients who did not want any anesthesia. They did not have any pain. As a matter of fact, in Europe, where I went to medical school at the University of Geneva in Switzerland, we did not use TIVA, monitored anesthesia. We just used a little bit of fentanyl, a little bit of Versed to sedate, And some patients were actually partly awake during the procedure. And I have no issue with doing that. You can stay partly awake during the procedure. Very few have actually done the procedure completely awake and wanted to watch the screen. It is not painful, it is uncomfortable, as you may experience a little bit of gas, as we do insufflate the colon with air as we go in, and we insufflate with carbon dioxide as we go in. A second question. I already did a stool test. I don't need a colonoscopy. False. That is absolutely false. Keep in mind, guys, that colonoscopy is the only way to actually go in and remove polyps. And that's the whole point of a colon cancer screening, right? We want to actually go in, and if there are little growths, which are called polyps, little tissue growths, which we know if they actually stay in place and continue to grow in place, they turn from adenomatous polyps into adenocarcinoma. So we go in there to actually remove them. Now, there are other ways to screen for colon cancer, and some of those ways are, yes, doing the FIT test, the blood test with your doctor, mailing that in every year. But we generally definitely still recommend a colonoscopy as the best test to do, because some of those blood tests can sometimes overdiagnose or underdiagnose. And again, doing a colonoscopy is the best way to go in, is the only way to go in and remove polyps. There are also Cologuard kits. So the kits that actually can tell you if there is a large polyp or early cancer, and that has become very popular. But over the last 3 years, we've also seen a lot of false positives with those kits, right? Where it shows up positive and patients are panicking that there's something going on, and we get in there and sometimes we find nothing. It's almost 50-50. Sometimes we find nothing, sometimes we find significant polyps. I say whatever type of screening you can do is better than no screening. So if it's going to be through the little cards that you mail into your doctor's office, or it's going to be through the Cologuard kit, that's better than nothing. But ideally, the best screening test is a colonoscopy. I have to drink a gallon prep. You may have to. You may have to. I usually will reserve the gallon prep, the full go lightly, also called new lightly, GABA lightly, to people who suffer from constipation, so they don't have regular bowel movements. They take medications that maybe slow things down, like pain medication, or diabetic patients, and also sometimes in patients with renal disease. So we do scope patients on hemodialysis. They go through their prevention as well. But there are so many preps right now. We don't have that perfect prep. We don't have that little 1 cup that you drink. And I wish we had that. And I can't wait to invent that or have someone invent that. But most of our preps these days are 2 small bottles, no more than 16 ounces, sometimes even less than 16 ounces, 12 ounces, 12 ounces, but then drinking a lot of fluid. So it's rare in my practice that I use the full gallon. It's very common in my practice that I use what we call a low volume prep. And more recently, we have tablets that are less than the tablets we have. And we used to have prep tablets and you'd have to take 32 pills, okay? So you would take 20 pills the night before and 12 pills the morning of. This number has actually gone down with a new prep called SUTAB, S-U-T-A-B. So please ask your GI docs about it. It's only 12 and 12 tabs, so much less. And then you just drink water with that. You still have to drink at least a half a gallon of water, but you don't have that nasty taste. So in terms of that question, it's not always a gallon, okay? I'm relatively healthy. Question number 4. I'm relatively healthy. I don't need a colonoscopy. I thank God that you are healthy. However, colon cancer is really one of those cancers that is completely preventable if caught early. 90% of colon cancers is cured if caught early. And very often you don't have symptoms in the early stages, right? By the time you develop rectal bleeding, abdominal pain, change in bowel habits, this is an advanced cancer. It is quite large, it is obstructing, so we want to catch it when it's early, and we know studies have shown that screening colonoscopies to detect colon polyps and remove them while they're small is the best way to prevent colon cancer. So you won't have symptoms. And again, many a times, and the best testimony is actually a patient where a patient has come in for a screening colonoscopy at age 50, no symptoms, and I found a cancer. And I'm glad they came in when they came in because we found the tumor. And as you know, we are actually recommending colonoscopy starting earlier at age 45 for everyone. The United States Preventative Task Force just actually released their new recommendations for age 45. We are waiting for all the insurance companies to change their policies and catch up with this new recommendation, simply because we're seeing an increased incidence of colon cancer in our much younger population, especially the African American population, but it is affecting all populations, okay? So healthy, yes, get that colonoscopy screening and stay healthy.